people aren't staying for their pension anymore. That's not a thing. My grandma had her pension, but I think that's probably
It's
a
a
thing of the
rarity.
past. Yep.
It's very rare.
She's
Yeah.
93.
Yeah.
So, yep. But she had a pension. How do we get how do we get therapists to want to stay and to want to become invested in the practice?
Well, I think that's one thing too, right? Like what we were just talking about, having that collaborative sort of culture is really important because they feel like they're invested, they feel like they're involved in decisions with the treatment. They feel like they're like, a key player in the team. So I think that's a big component of it.
And I think that learning from each other. So I
Yeah.
think that, if it's like the doctor is the one who knows everything and you just are technicians, then I think that makes it like you're going to be much more likely to leave. And so, because then you feel replaceable. So I think
Right.
that for us, everybody knows a lot about something. And I don't know if there's one person who knows who knows it all. And so I think that we collaborate with our knowledge as well. So then when it comes to, a particular condition that's coming in or a particular genetic disorder, then we can tap on each other's experience in those different areas. But then also we do research presentations too.
Right.
So we do research, we make sure that we're kind of staying at the cutting edge of everything, and then we're presenting that information to each other. And when we go to conferences, we come back and we present all the information to each other, and so that everyone's kind of really growing and learning all the time.
That way, especially when you're in a field like, well, I mean, we are in a bit of a niche in vision therapy, and a lot of people don't go to school to become vision therapists. So sometimes, like, people try it out and see, like, oh, it's not for me. But if they don't feel like it's a career that's like, that they can see a future in, I think that's why learning is so important too. Is that it's like you can see this as a fully fledged, very fleshed out, very real career. Because often I'll go out and I'll say, oh, I'm a vision therapist. And they'll say, what is that? And then I have to explain it all. But I know that there's a whole field of other professionals who are vision therapists like me, who have invested time, energy, money, et cetera, et cetera. If you invest in the learning and the development, not just, for your team, for your patient's benefit, but also for your therapist benefit, for your staff's benefit, because then they know that this is a career that they can stay in and they can grow in.